Welcome back, West Michigan. I'm Linda Balkema. You're watching Alive and Well, and we are talking about the Muskegon Area Medication Disposal Program. And we were talking a little bit about controlled substances, so I want to ask Ron specifically about Vicodin, because that seems to be a very commonly prescribed medication for pain. Dentists prescribe it. I can't tell you how many times I've had Vicodin prescribed. So, and I don't like it myself, but people love it. I cannot believe, not where I work now, but former coworkers where I used to work about 10 years ago, they'd say, "You've got Vicodin? Really? How much do you want for the rest of that Vicodin?" I've never sold it. I would never do that. And I thought flushing it was the safe thing to do. No, don't flush your medications. So, Ron, is Vicodin a controlled substance or not?
Yes, Vicodin, along with Tylenol number 3 and now Norco, because it's got a reduced content of acetaminophen, are class 3s.
Class 3s, okay.
They're highly addictive. They contain hydrocodone.
And what is it? Yeah, there's a long name. Because mine never says Vicodin. It says
It'll say hydrocodone,
okay.
and then it may have a slash APAP or acetaminophen.
Okay, so hydrocodone is actually Vicodin when you're looking through your medications that are up in your cupboard. And you don't want your kids or anybody getting a hold of that.
No. And you're right, there is a huge demand on the street for hydrocodone.
And I understand they mix it with things like codeine there's all kinds of things going on with it, and it's not safe. I don't know why people like it. I don't get it, but...
I know. It doesn't work for me either.
It doesn't do a thing for me.
No.
But anyway, that's good to know, and it's very commonly prescribed, so I think that people should look for that and bring it to one of the sites.
Like you say, the dentists, after surgeries, what we've seen in the past, just a little bit, is quite oftentimes after surgeries and things like that, the doctors will prescribe prescriptions for Vicodin. They'll be used for short-term use, and then the rest end up going up in the
cupboard. Yeah, and pretty soon you have 3 or 4 bottles of hydrocodone, right?
Right.
You know, Linda, the one thing we found through this program is with your non-controlled medications, people are typically more willing to release those and to have those destroyed. Your narcotics and your controlled medications, they usually try to hang on to them. And interestingly enough, we had someone share with us Monday at a meeting that they've had a prescription for Vicodin actually in their cabinet for 6 years. And medically they knew that wasn't appropriate, but they've held on to him. And he just took the last one recently. And
well, because
you have the savings mechanism mindset.
You think that, it really doesn't work much, but if I'm really in severe pain sometime, or if I slip on the ice, I might need it, and it's better
not
to
recommended, especially that long in your cabinet. So because it does change the strengths, as Ron had mentioned.
Right.
And so it's really important to really keep that cleaned out and keep it up to date. So yeah, it's across the board. It's not just
and now
naughty people, as people think they keep these things and trade them, and it's everybody has.
Well, and
those.
there's a fear too that doctors will, because of the awareness, they're getting harder to get. Doctors are being, as they should be, a little more cautious about prescribing it. And I think that it has its use, obviously,
right.
And it does work for some pain, and it works well for some people, but. Yeah, it's really easy to misuse, and I think that the main thing I'm hoping doctors watch for is how many times they're prescribing that to a person.
Well, that's what we met about on Monday. The latest facet of our program that we're working on is we have done the education, continuing the education with the community, but now working with physicians, because it starts in their writing the prescription out to the patient. And typically, as patients have shared with us as they've come through the program, I've taken 2, I've taken 3, I didn't need any more, and now I have a 30-day or 60, maybe 90-day, depending on the type of prescription, and they haven't done anything with it. So now it's wasteful. And so what we're trying to do in reaching out to our physician population is when they have a surgery or if something occurs, and you're going to see them back in 10 to 12 days or 10 to 14 days, prescribe for that amount.
Sure.
And that way, if they need another prescription, they can come back and counsel with them. They can see what is maybe needed. Maybe it wasn't appropriate or it has a side effect.
Right.
And then you don't have so much waste. And it's actually very costly. And there's a lot of people out there who don't have health insurance and prescription coverage.
Sure.
So
and you're right. There is a lot of waste, because sometimes, and Vicodin, again, for example, I've been prescribed that and it didn't do a thing for pain. And so I'd have to call a doctor. And you're right. The insurance programs quite often, they don't want to give you, cover Vicodin and then cover something else, because there's a lot of people watching this now.
Sure.
Big concern.